this does come back to,
The subject matter is fine, right? The question is, how do we line up with what Janet's doing upstairs? So, no one's in opposition to the bill. Why don't we report this, send it upstairs, line it up with what's happening up there. We asked DOE to come back with numbers last year, the year before last on Center House Amendment. They decided that they didn't want to do that, or they didn't do that for some reason. And so we have another way to Center House. I hate to have two policies going up, one in code, one in budget language on how to do that. So without, if we don't find, we'll send it upstairs, line it up, and make sure we're getting information. Is that okay? Perfect.
Thank you.
So, is there a motion that we report we refer to finance?
So moved.
Motion is second, we report we refer to finance. All those in favor say aye.
Aye.
Those no, is report we refer to finance.
Thank you.
Senator Tatum.
Thank you, Mr. Chairman. I'm here to talk to you about Senate Bill 1233. And there are several amendments.
So the clerk will report the amendments.
Thank you, Mr. Chairman. Senate Bill 1233 was heard in Health Professions Subcommittee. They adopted several amendments. On page 4, line 187, after psychiatrist, insert employed or contracted by the facility of which the person is being held for evaluation. Also on line 189, after employed, insert or contracted. Same line, after the person is strike detained, and insert being held for evaluation. On line 211, after board, insert was certified evaluator pursuant to subsection D of section 37.2808 or subsection D. And on line 240, after board of the strike issuance of the order, insert magistrate's intention to issue a temporary detention order once a temporary detention facility is identified by the community service board.
Okay, there's a motion on the amendments as reported. Yes, there is. Okay. All those in favor of adopting the amendments, will say aye. No, the amendments are agreed to. Senator Chafin, why don't you give us a primer on your bill, and then I know there's some that have some concerns about pieces, but let's go through your portion first, and we'll hear from those who are probably here.
Yes, Mr. Chairman, I will. And I understand also that there is an idea, or maybe will be a motion to make this a pilot program just for planning districts 1, 2, and 3, which may take away some of the sharper criticism from the people. But this bill authorizes a certified evaluator to conduct pre-admission screening in lieu of a community services board emergency workers if the emergency worker is unable to arrive to the emergency department within 2 hours of the request for pre-screening evaluation. Currently, the law is that the CSB emergency workers are the only individuals who can compete in evaluation to determine if an individual meets criteria for a TDO or temporary detention order. When a CSB emergency worker is delayed in arriving at the emergency department to complete the emergency evaluation, there are a number of negative unintended consequences. And the CSBs do a really great job with this, but out in Southwest Virginia, between our hospitals and between our counties, there's often an hour, hour and a half just in drive time to get to one place or to the other. But the issues, the patient that occur, patient waits in a crisis state, precious time is depleted, impacting the amount of time available to complete the multiple steps involved in the commitment process, and it increased transfers of beds and last resort as a result of completing time in search for bed. Now, this option that we're discussing here would only be utilized by hospitals if an emergency worker can't arrive within 2 hours of an evaluation request, and the hospital has the capacity, capability to complete the evaluation. Hospital staff are already required to complete a psychiatric and medical evaluation before the CSB is even called, and the bill envisions having eligible certified evaluators evaluators to include emergency physicians, psychiatrists, licensed professional counselors, licensed clinical social workers, licensed clinical psychologists, psychiatric clinical nurse specialists, psychiatric nurse practitioners. They'll undergo that class of individuals, those group of individuals will undergo the same certification as the CSB emergency workers. And of course, there are some of those individuals who possess a higher level of medical and mental health education, making training really redundant in those cases. These evaluators will complete the same pre-admission screening form, and they will be available to appear for commitment hearings in person.
I think we got it.
Yeah.
I think we're good, and I know many of us have heard a lot of discussion offline because your bill was raised a bit concern. So you've done great, and if we could just hear, if others that are here to support Senator Chapin's bill, you come forward, we'll just hear those briefly. And I apologize, we're running into a hard clock here today. Welcome, and just go.
Mr. Chairman, members of the committee, Jennifer Wicker with the Virginia Hospital and Healthcare Association, and we thank Senator Chapin for all of his work on this bill, and we understand that there is a place of consensus, and we support that. We have a gentleman, Dr. John Hagee, who has traveled from Lebanon, Virginia, with Mountain States Health Alliance, who would like to say a few things.
Welcome, thank you.
Mr. Chairman, members of the committee, again, as Jennifer said, I'm Dr. John Hagee. I'm the program director of Clearview Behavioral Health at Russell County Medical Center, which is part of Mountain States Health Alliance. We also appreciate the work that Senator Chapin's done. I want to highlight 3 situations, 2 within the last month and another one last year, where the pre-screener couldn't get there until quite a while after the 2-hour limit. In the last month, we requested, and due to other psychiatric emergencies going on in the county, it was over 5 hours before the pre-screener got there. Last year during the winter, roads were severely dangerous, so the pre-screener wasn't able to come until the next morning, which was over 12 hours. All 3 of these situations, we had psychiatrists and/or emergency department physicians who were qualified and trained to be able to complete these evaluations. And we think that the CSB in our region does an excellent job, and we have a good relationship with them. We want to be able to help in these cases, to help also with ED throughput. But, you know, I've heard that maybe the percentage of people that are over 2 hours is small. But think about this. If you're a family member, if my family member were one of that small percent that had to wait 5 or 6 hours to get the psychiatric care they needed, and they were in a crisis, is that a small number? We believe this is the right thing to do for our patients.
Thank you, Mayor, and thank you for your travel. So, those that, all those that are going to support the bill, those that have your support, come on through.
Good morning, Mr. Chairman, members of the committee, Sarah Bosher, on behalf of NAMI, National Alliance of Mental Illness, we support this bill and thank Senator Chapin for all of his hard work.
Thank you for coming by and talking with us. Yes, well,
Mr. Chairman, members of the committee, James Pickrell with the Psychiatric Society of Virginia, we are in support of the bill.
Good morning, Amy Parent Sauer on behalf of the Virginia College of Emergency Physicians, and we too support the bills. Appreciate it.
thank you, yes. All right, so those that have contrary view, would come forward.
Good morning, Chairman Gruen and committee members. My name is Jennifer Spangler. I have a lifetime mental health challenge, and I urge you to oppose Senate Bill 1233. At times of crisis, when I'm most in need of help, I do not need a speedy transition between an emergency room and a hospital bed. That is what my care providers want me. When I'm distressed, communication is frustrating. I want help, but I can't articulate what I need in a timely manner. And when I can't do that, I'm scared. This happens every time I'm hospitalized. An assessment, according to an ER doc or somebody who is there with me, that hears me talking for 2 hours, that sees me agitated, is biased. Having a fresh pair of ears is crucial in creating a place for my voice to be heard. Since I still to provide a bed, I prefer to wait for them to assess me as well. Patient care is more important than provider convenience. Thank you.
Okay, well,
Mr. Chair, members of the committee, Daniel Hurd with DBHDS. DBHDS does not have a position on the bill, but have three things we'd like for you to take into consideration. First of all, in the 1980s, this general issue was studied for almost a decade, with the JLARC making recommendations that were adopted in 1994. Essentially what was found is that when private evaluators are in this role, there is a tilt toward involuntary civil commitment and challenges around the quality. DBHDS recognizes the need to study this issue. Actually, in 2014, HB 2368 charged DBHDS with getting all of the stakeholders together, of which Virginia Hospital and Healthcare Association has been a part. That group found that the median response time was 30 minutes, that 94% of all evaluations were started within 90 minutes, that 97% were started within 2 hours. As a result of that finding, DBHDS continued that study group, which is working today to address the 3% of the outliers. That report will be finished shortly and forwarded to the Dean's Commission, which is looking at this.
thanks. Anything else we've discussed? We like this, there's lots of this, so we got to.
I understand. Senator Newman, members of the committee, my name is Jennifer Faison, and I'm here representing the Virginia Association of Community Services Boards. I would like to just concur with Mr. Hurd's remarks and say, there has been a group that's worked on this issue for 2 years, that's nearing completion of its work. You have the Deeds Commission, who is currently looking at all parts of the system and maybe a more appropriate place to situate a further discussion about this. In addition, you'll note in the bill that there are some of the clinicians, some of the hospital workers who would be required to be certified through this bill, and we actually agree that anybody who is going to be performing these evaluations should be certified. But there is a lengthy and thorough certification process that does require some training and supervision. And so really it would require those folks to be with a CSB clinician for a pretty significant amount of time. And just would like to note for the committee that will be a fiscal impact for the community services boards in order to ensure that these folks are getting the appropriate training and clinical supervision. It also creates an ambiguous kind of legal relationship when we've got somebody who may have a situation where we're out on a call together with somebody that's in training with us, and if something were to happen, there's some questions about legally where that was set. So.
Very good. And quickly, if we just have, are you also here to speak in opposition? Yeah. You do it quickly. We're about to lose members and things are cut, and I want to make sure that we have that.
Sure. Hi, thank you. Bonnie Neighbor. I am a mental health consumer with 5 different diagnoses, and I was formerly with VOCAL, the statewide mental health consumer recovery network. I've had the privilege of, because of my former job, I've had the privilege of talking to a lot of folks in the state who have mental health concerns, and they have grave concerns about this bill because a few reasons. One is that a certification, somebody who's received a certification, the special training, who does the evaluation, doesn't necessarily have any way for a complaint to move forward. If they did it inappropriately, or if they didn't follow the right regulations, there's no quality control over certification versus a license or registration or something. So that's one of the concerns. Another is that a lot of my peers just don't think it's a good experience to be evaluated by an ER doc. You've heard one of them already. And a third concern that I personally have is I believe that the process of having an ER doc or someone else who's right on site do the evaluation doesn't really speed up the TDO process. It just gets the evaluation done earlier. The TDO doesn't happen until the CSB worker is on site and can start looking for a bed and finds a bed. So it's not gonna really speed up, if the CSB worker isn't able to be there within 2 or 3 or 4 hours, it's still not gonna speed up the process for them getting the TDO.
And I appreciate your personal kind of thoughts on that. And really does help. I think there is maybe something that will help. I would say it will give us peace and value, but if we restricted this to a single section,
I would ask that we amend the bill to only affect the planning districts 1, 2, and 3, which would cover Southwest Virginia, and Wilson, and Washington.
Second.
That's fair, yeah.
There's a motion and a second that the bill be restricted to those planning districts. All those in favor say aye. Aye. Those no. And it is done. Is there a motion on the bill? Second. It's a motion and a second that we report and refer to finance. All those in favor say aye. Aye. Those no. The bill report. Okay, next up, I think we're going to go to Senator Howell has got a bill, which is Senate Bill 1419, as he's asked to be stricken. All those in favor say aye. Aye. Those no, and 1419 is stricken. So also, we have Stewart's bill, which is 1246, that he's asked to be stricken from the calendar. Motion is second to be stricken from the calendar. All those in favor say aye. Aye. Stricken from the calendar. So up next, I guess, is Senator Favola has Senate Bill 1500 that we deferred that bill last week. She has asked that that bill be go PDI and the subject matter go to the future public education. Is there a motion? Motion and a second to Senate Bill 1500, the PDI and the subject matter go up to the future public education. All those in favor say aye. Aye. Those no. That's done. Okay. So I guess now we will go to the committee bills. And to do that, why don't we do the virtual bills? Because I think the virtual bills have got to be in finance even if we're here late on Friday. So Senator Dunlap, why don't you do yours? And then we will do Peterson's version and then we'll do that. And that's right. And then, guys, we do need to make sure that any of the bills that we finance, we send out because those may die in their own ways. So Senator Donovan, I think you actually have 2 bills that fall into that category. Then Barker, you got a bill that's got to go up.
Yes, so the bill that I had that falls in that category was part of the subcommittee report that we had to pass by temporarily so we could get a copy to substitute. But I'll start with virtual schools. The virtual school bill that I am proposing is the one that we passed last year that everybody is familiar with. And with respect to everybody's time, this has a centralized school board that would function to admit the children and register them. It would be limited to 5,000 children. The state's share of the average SOQ, the average SOQ for each child would be attributed to cover the cost. And it would provide free access for parents or for the school systems themselves. And not to try and be too brief, but I think that probably essentially represents the bill.
Okay. Are there those that said 4 o'clock? Are those who are here to speak in favor of the bill? If you don't mind, without objection from the committee, we'll sit about the 4-minute clock and we'll look at support ways. Is that okay with you guys on the other side?
Yes.
Well, nice to see you.
Thank you. Duncan Gatchell, I'm a lawyer at Memorial Woods, and I was formerly Solicitor General of Virginia. Just wanted to briefly address constitutionality with reference to the letter that came over from the Attorney General's office. In my opinion, the incorrect constitutional standard was used in drafting that letter, and that if the correct standard were used, the conclusion in the letter couldn't be reached. Under the Virginia Constitution, unlike the federal Constitution, the General Assembly has plenary powers unless they are clearly limited
in the Constitution or by the federal Constitution. Here, because of the historical practice of having non-geographical special schools like the School for the Blind and Deaf, there's a historical precedent before and after the adoption of the Constitution for this, and therefore it's constitutional.
Thank you, Don, appreciate it.
Good morning, Mr. Chairman, members of the committee. I'm Chris White with the Vector Corporation. I'm here on behalf of Public School Options. I think Senator Dunn did an excellent job in terms of explaining the bill. It will provide additional access because now the Senator Dunn bill will be able to expand to K through 12, where the current virtual academy is only a K through 8 school, and it will provide, ensure that we don't have to have local partnerships with school divisions where we've had school closings before, like we saw in Carroll County in 2013. There are currently 1,500 students in the Virginia Virtual Academy. I didn't want to ask parents to come and trespass on the community's time, but I did ask one parent to come to share his story about why virtual education and the Virginia Virtual Academy works for him.
Thank you. Yes, sir, welcome.
Thank you. Dr. Joseph Franzio. I'm also a major in the U.S. Air Force Reserves in addition to a government service employee for the Department of Veterans Affairs. It works for us because we've had multiple school districts in Virginia, in addition to multiple schools across the United States being involved with our education of our children. And while we're doing this in Virginia, we're actually able to utilize this program to ensure that my children, which are both on the gifted intelligence side for advanced education, are actually able to move along at the pace they need. In addition to that variability of place that allows us to, when I'm in training or when I'm sent away for travel or other things, that I don't have to be separated from my family at all times. Thank you very much.
Thank you for your service to the country. What's your boy's name?
Xander.
Nice to have you here today. Great. Thank you for those that are here to speak in favor.
Thank you, Mr. Chairman. Senator Dunn, for this legislation. Ryan Pearson, the Virginia Chamber of Commerce, and with the former members extensively on these issues and increasing options for students, and it's important to support the bill. Thank you.
Thank you, Senator Dunn, for those individuals. Those that have some concerns about the bill.
Thompson Defense Association. Our concern is in part because of setting up a separate state agency to do this. We feel that these programs are best connected to the home school in terms of the school board. We often get children back after they leave us, including homeschoolers, and set up a separate board and a separate set of regulations and experiences would make that coming back difficult. So we feel, again, this is handled best at the local level with the local school board. We have many school divisions that are moving in this direction, and so we would ask that you oppose the bill.
Thank you for coming by.
Morning, Mr. Chairman, members of the committee, Kathy Birch with the Virginia Education Association. We oppose this methodology for establishing virtual schools here in Virginia because we already do have a system here in Virginia, and many school divisions are looking at ways to expand that through local control. Studies indicate that there's still a lot to learn about the success rates of virtual schools and the completion rates of virtual schools. As Mr. Smith mentioned, or Dr. Smith, I'm sorry, that oftentimes those students are brought back to our local schools. We know that students who are successful often have very high levels of parental supervision and parental involvement, which is what you heard this morning, certainly with our families who are having success in those rates in those schools. But we want to make sure that those students who are choosing this option are tied to their local school and also have the access to counseling to make sure they are the right students choosing the right schools. So we ask that you oppose this bill.
Thank you for coming by.
Mr. Chairman, members of the committee, Holly Coy with the Secretary of Education's office, and the administration continues to have constitutional concerns about this particular governance model, but is in full support of virtual education.
Mr. Chairman, Stacey Haynes, School Board Association again. I too have serious constitutional concerns regarding this legislation. I think that it violates Article 8. Also, the funding piece still hasn't been addressed. And so this bill is, the funding piece in this bill is based on the SOQ for bricks and mortar schools. And it's not apples to apples because the staffing ratios aren't the same. None of the things that we have with the bricks and mortar school translate over to virtual schools. So I think before we move in this direction, and we've been saying this for years, and Pat's been saying this for years, before we go in this direction, we need to define what is a quality virtual program before we can tackle funding these. And so for those reasons, we move this bill.
Thank you. Anyone else who's speaking about this?
Very much with the Federation of Teachers, we oppose this proposal.
So, why don't you wrap up and we'll look at questions that we may have and we'll move forward.
Thank you, Mr. Chairman. I think in some ways we're back to philosophical, situation here. I firmly believe that we need to offer the kids in the Commonwealth every diverse opportunity of education. I want to make a few very important points. The Department of Education in Virginia approves all of the providers, the MOPS, so we've got the quality box checked. Let's talk about money. This is the average SOQ. They ran the numbers. They looked at how many kids currently participate in the program. When you look at the averaging out, it was basically a zero balance to the best of their ability to know. I will also say that the year-to-year cost of this program is far less than the program that currently enrolls less than 150 through the Department of Education, which costs us about $480,000 a year. This would be a one-time cost of $250,000. This is good for the Commonwealth. It's good for our bank, and it is a couple other things. We don't have great success and completion rates in many schools. So to say that this may not happen is not a sufficient means to argue about.
Okay, good. All right, very well. We have, we've heard the bill. There's a motion and a second that we report the bill. Clerk, call the roll.
Mr. Chairman, so we're going to hear the other bill while we,
We didn't roll that bill in. Some people talk about rolling it in, so I thought we'd hear it separately, but if you'd like to hear them and make a determination.
I think they're mutually
Non-exclusive?
yeah.
Okay, well, hold the motion, then Senator Peterson will hear your.
Thank you, Mr. Chair, members of the committee. By the way, Senator Dunn and I have been talking literally even this morning, this whole time, and my goal is just to be a part of this process. I'm carrying Senate Bill 1380, which has a substitute, which I'd like to distribute.
So motion on the substitute.
Because I'd like to see it.
Motion is second to substitute. All those in favor say aye.
So where's the substitute from then?
Let me just talk about this. This is a bill which I carried on behalf of the administration, and quite frankly, it looked very different at the beginning. I can honestly say I sort of molded it towards something that I can live with, and that is using the existing structure. By the way, I believe in virtual education. I think it's important to have a full-time virtual education option available for all kinds of populations, homeschool populations, kids that have trouble learning in the classroom environment for all sorts of psychological or just simply sociological reasons. I believe in it, and I supported the bill last year, but I think we were kind of fighting ourselves against a stone wall, and I don't want to see it do it again this year. So what this bill does is basically works within the existing school divisions, but also says, before everyone says, oh, you're going to have 126 different results, it says the school divisions can work together, they can contract together. Large school divisions like Fairfax County, for example, can pull in smaller school divisions and enter a contract with MOPS, which is to say online providers that have been vetted by the Department of Education that will also negotiate the contract rates. So the Department of Education will be involved on the front end, they'll negotiate the contract rates, they'll also be there to assure quality, and then they can make this option available, and then the school divisions can basically work together to make this option available to up to 2% of their school population. And I think sometimes I hear from the other side, well, we're going to deal with all these different school divisions. Well, I don't think so. I think you'll see some leaders that will be out there that will enter these contracts. Other school divisions will team together, but we'll be able to do this working within the existing system. And here's the beauty of that, Mr. Chair. By using the existing school divisions, we can work within the ADM. We don't need to sort of rewrite all of our rules on school financing and school funding, which of course is always, the most lethal argument we have in this building. We can just simply use their existing allocations. So I think there's a beauty in this and its simplicity, and I'm a simple guy, I like simplicity. So that's basically what I proposed, and I'll leave it at that, and I'm happy to answer questions.
Okay. So these bills, I think technically could both go, but they are not in the same direction. In other words, we sent out two policies. So I think the committee's decision is best to be which way we roll the bills, honestly. And then we from there allow Peterson and Dunn to continue the work and decide how they allow for both systems to go forward as for long. At least that's the way that Tom and I talked about this.
And Mr. Chair, if I might, even no matter which direction you go, I'm gonna ask that you keep me on the bill, because if it does go to conference, I need to be part of it. Because if it becomes a Republican or Democrat thing, this thing is gonna be dead. So,
That's probably
please see me on this.
okay. With that,
Mr. Chair,
Mr. Pete.
Mr. Chair, make a motion to roll 13A into Senator Donovan's bill to be already heard and report.
Second. Okay. And we report and we refer to finance, right? Okay. There's a motion and a second that we roll Senator Peterson's bill and Senator Donovan's bill and we report to finance. All in favor say aye.
Chairman?
Yes, I'm sorry, Senator Al.
Thank you. Does that include putting Senator Peterson's name on the bill?
It does, but not his language, so his good nature, but not his So with that, motion is that roll the bills and Mr. Senator Peterson's name on the bill and refer to finance. All those in favor say aye. Aye. Those no. No. Please report your no's.
I'll be a no, even though I'm in favor.
Maybe helpful on the floor too, or the conference too. Okay, so there's, the bill is reported to refer to finance. Thank you very much. Senator Peterson, thank you for your help. Senator Dunn.
Just as a follow-up, I truly believe Chad and I can make this work. We are both passionate about getting virtual education in virtual.
All right, Senator Dunn, you have another bill?
Yes, sir. I'm going to do that from the desk of the day.
So the next bill is
Mr. Chairman,
Senator Sudan.
I just say, I don't understand why we're adding someone as a chief co-patron when they're voting against the bill. I mean, should I just file bills so I have others so I can be chief co-patron on the conference committee?
I don't think that's the purpose in this case, Senator Sudan, but I think that every member, one member has the authority to become a chief co-patron if they vote for him. That's the policy. But then the policy has been you can vote through conscience on bills. When you put those two together, that's the way it is. Senator Dunn.
Thank you, Mr. Chairman. This is Senate Bill 1561, and I am referring to the substitute from the committee.
There's a motion and a second that the substitute be agreed to. All those in favor say aye. Those no, the substitute is agreed to.
So the committee had a conversation about this, and essentially what this bill does, as previously noted, is to create that exchange of information in an actionable way that can lower costs in Washington State for the implemented this program across all patients and all ERs. They save $32 million a year. And so this is a way to improve the quality of patient care, to shorten ER times, because we're going to take away unnecessary testing, to access the PNP and make sure we're taking care of the issues that we have with the opioid addiction, and also make sure that patients get to the right place for their health care, which is sounded with their primary physician and primary medical home.
Okay, seems like it's pretty well worked out. Anyone here to speak in favor or in opposition to the bill? If this bill is requested to be reported, it does need to go to finance. Is there a motion on the bill?
Second.
Motion is seconded. Report to refer to finance. All those in favor say aye. Those no, those report to refer to finance. Senator Parker, do you mind doing yours? Because yours must go upstairs too. Senator Parker, you turn your attention to Senate Bill 1222, psychiatric patient registry. There is a substitute, or you're aware of a substitute, Senator Parker?
Yes.
Substitute on the bill, motion and second, that substitute be agreed to. All those in favor say aye. Those no, substitute is agreed to. Senator Parker.
Yes, Mr. Chair, this is the, in effect, the reverse psychiatric bed registry proposal.
to have facility, patients who are needing placement within a hospital under TDO, when there are issues and challenges in finding an appropriate placement, particularly locally, to be able to have a registry that sort of has just those patients on it there with the substitute here. That then hospitals can have access to that, and they say, we have empty beds, we can provide services to a lot of these people and initiate contact, so that it's not solely upon the community services boards and others to find the bed. The intent here is to have it be, the design here is to have it be optional, so that this would be only for those patients for whom there is difficulty finding a placement. It's not putting everybody on the registry, but it's only those where there's difficulty finding a placement, particularly difficult finding a placement locally.
Mr. Marcotti, so this makes a lot of sense. There are those here that are opposed to it. So let's just see what our concerns are. I think this one is some work out unless there's some new information comes through.
Thank you, Chairman Goodman and committee members. Again, my name is Jennifer Spangler. I'm in recovery from a mental health challenge, and I oppose this bill. I've been having the option is still going to cost money and time keeping this registry, and I just think it would be better suited to support connectedness in an outpatient setting for providers and avoiding hospitalizations altogether. Frequent or high utilizers of hospitalizations need to be directed to a medical home, not a hospital. And Virginia needs to be in the business of preventing hospitalizations, not catering to them. Thank you.
Thank you very much. Are you guys in favor of the bill? Is there a motion on the bill?
DBHDS, would you like to make a comment? Good morning, Daniel Rowe, DBHDS. Senator Rowe, appreciate your interest and commitment to addressing the reduction of the private sector's role in accepting TDOs. We just want to point out on behalf of the committee, DBHDS does not have a position on this bill. The challenge, I think, is the de-identification of data as presented in the bill may not comply with the requirements for managing protected health information. And there's questions about the practical utility of that if it's de-identified to the point that it no longer violates it.
Okay, we got to, since it's got to finance, you work and just find out there's a real need there, we'll look at that all the way up. So, Senator Dunley.
If we can look at that, I mean, my concern about this bill is a whole lot of work, and I don't see how it actually helps place anybody in bed. CSB still have to call, the same process still needs to be carried out, so unless somebody's going back to the computer and looking at this registry and are hungry to fill a bed, it's just, it's not actionable, and that's my concern.
Thanks, Senator Barker, real quickly.
Yeah, Mr. Chair, I think this bill, as it's designed here, is actually very helpful to the process, because what it does is allows, and it's purely voluntary, allows the Community Services Board or other entities involved in trying to find a placement for a TDO to say, we have this patient, we've not been able to find a placement yet. It allows then the hospitals to be able to monitor that, so that a particular hospital says, we think we might be able to take that patient, that they can step forward, contact the CSB, say, we can help, we may be able to help in this situation, here's what we can provide, make sure that there's a good match there. I think it helps get the placements being made earlier in those challenging situations. It also means that more of those placements will be made in private hospitals and rather than state hospitals, which has been clearly been an issue.
Yes.
Chairman, I move that we support the bill, move to finance.
Second. There's a motion and a second for the bill to report to finance. All those in favor say aye. Aye. Opposed, no. Reported no. And the bill is reported to refer to finance. Mr. Barker,
I have one other.
Senator Barker.
Senate Bill 1017, I think, 1017. You've got someone here from the Prince William County School Division who can help answer any questions and add to what I'm presenting here. What this bill would do is make it clear that school attendance officers or others would have the ability to file papers within the court system particularly when there's extensive absenteeism of the students, those types of things, and there has to be filing in court for a child in need of supervision. Right now, there's at least some question as to whether this is a proper practice or whether the papers themselves literally have to be filed by an attorney. This would make what is basically an administrative function here much simpler and much less costly to do. It has been used in other situations and was just upheld by the Supreme Court, Court of Appeals in Virginia, as it relates to social services workers filing similar types of things. So it seems to me it makes a lot of sense to be able to do this and provide this option. It's just filing the papers that I've argued in any cases equal. And I do have one person to speak to the bill.
Sure.
Good morning. I know you're playing beat the clock, so if anybody has any questions, I'm happy to answer them. I'm Mary Miguel, I'm Division Counsel for the Prince William High School.
Very good. Any questions to the, okay, thank you very much. Is your favor? I looked at this earlier. I think it's pretty straightforward.
Move to report.
There's a motion and a second. The bill to be reported. All those in favor say aye.
Aye.
And the bill, all opposed, no. The bill is reported. Senator Parker, thank you very much.
Thank you.
Okay, up next is Senator Fairco, on your 1327. We decided that we were going to let it go out for the year and then have that subject matter discussed in our subcommittee. Is that correct, sir?
That's correct, and if I could just say a couple of things about it. LMU, which is a college right on the border of Virginia and Lee County, has invested a lot of time in Virginia because of the Appalachian region, trying to do some things that will benefit that region. They opened a veterinary school of medicine in Lee County, and it's thriving and doing well. They've developed this program for pathway for physician assistants to move into becoming physicians in those areas of the Appalachian region that benefit from having those physician assistants working over those doctors in that region to stay in that region. This program will go a long ways, and it's been vetted by a lot of the federal educational requirements that are needed and passed the muster, and is being, this same licensing process is being taken to several different states. It's in the Tennessee legislature right now. The same bill is being vetted there, and I feel as a Virginian that we need to be on board to try to address some of these shortage of doctor needs in the region, and I think this is a pathway to do that, and we step up to the plate to offer a curriculum to do so, and hopefully over the year we can figure out a way that Virginia could be a part of that.
So this is a pretty big bill, and we've decided that we'll take a look at it. Scott, you're going to help work with us on this bill to find a way that we can educate the PAs to become DOs, version of MP going forward. Scott, thank you for going to do that. With that, there's a motion and a second that the bill be so by indefinitely and the subject matter being taken up by a subcommittee of this group. All in favor say aye. Aye. Opposed no. And the bill so okay, next up we have Senator McClellan's bill, which is 1476. She has asked that that bill be stricken. Motion to strike the bill. Motion is second to strike 1476. All in favor say aye. Opposed no. And that bill is stricken. Next up is Senator Black. You have two bills. Why don't you go ahead and take up those two bills, and then we'll get down to just a couple of bills left.
Thank you, Mr. Chairman. The first bill is Senate Bill 1516. And what this bill does, this is something we've been working on for a couple of years with a group called Decoding Dyslexia, which is headed by Lorraine Hightower. The situation that we got, there are a considerable number of children who suffer from dyslexia. They're very bright children. There's nothing inhibited about them, but they have a situation where they have reading problems that are based on the way that their brains function. It is correctable, and by correcting it early, you can have very successful outcomes and children who are extremely successful. And so what we tried to do is to have the bill have as low an impact as it possibly can have. And so we're not adding any personnel or anything, but basically simply saying that a reading specialist in each of the school districts will have an understanding of dyslexia and a working knowledge of how to deal with it so that they can disseminate that information within the school. That is the essence of the bill, and I do have witnesses here that, with your permission.
Sure. We just asked this week, you're in opposition to the bill.
Good morning, Chairman and members of the committee. My name is Lorraine Hightower. I've served on PTA and PTO boards for 7 years. I authored the dyslexia resolution that unanimously passed the Virginia State PTA of Parents and Teachers, and I currently chair the Loudoun County Special Education Advisory Committee that reports to the school board. I'm here today along with folks from Decoding Dyslexia Virginia to speak in support of Senator Black's bill. As you all may be aware, dyslexia, the specific learning disability of dyslexia, is the most common learning disability. As Senator Black said, these children are average to above average in intelligence, but they are challenged to read accurately and fluently, communicate their thoughts in writing, understand the language of math, as well as learn a foreign language. Senator Black's proposed bill builds upon the successful legislation of House Bill 842, which was a teacher training licensure requirement on dyslexia that is being implemented in July of 2017. In response to feedback from teachers, administrators, and folks in the school who say that higher ed has not prepared their teachers with training on dyslexia, they are asking for the support of a dyslexia advisor. This is somebody already employed by the school system. They are serving as a reading specialist, and they will be trained by the Virginia Department of Education. We've been working with the Virginia Department of Education. They've had a pilot program on the right type of methodology, early identification, all of the experience that a reading specialist would need to serve as a dyslexia advisor. They've already trained 200 teachers. They're going to train 80 more this summer, and this bill provides the opportunity to enhance this role with minimal to no fiscal impact.
Great, well done. All right, so we've got a couple minutes left. I think you're under about 4 minutes, so if you want to add more that quickly support that.
Thank you for having me today. I'm Jill McLaughlin. I'm from the Rockingham County area. I have 2 children with dyslexia. I just want to say this bill will help support other children with dyslexia. Once we give the tools to our teachers to start identifying, they will need someone to go to. So I hope you will support this.
Hi, I'm Leslie Heyman, also with Decoding Dyslexia in Rankin County, and I essentially echo what Jill just mentioned. In this case, I also have 2 children, 1 son, 1 daughter, both dyslexic, and I agree. This is going to help the educators and the administrators that have been asking for this sort of support. Thank you.
Hi, Cheryl Lafley, a parent of a dyslexic son, and also a member of Decoding Dyslexia, live here in Chesterfield County. I support this bill and urge you to also support it. At 6th grade, we pulled our son out of public school because most of the goals and accommodations that we were needing were all brought to the table by me. I have no background in education or literacy, and we need someone that will help identify the best way to educate our children. Thank you.
Thank you. Sorry, those that have
I'm Mike Asif. I'm president of the Virginia Council of Administrators of Special Education, speaking against the bill. Thank you, Senator Newman. And we do appreciate Senator Black's coming forth with dyslexia legislation. However, we feel, based upon even on what we've heard already, that the bill is not necessary, that training is in place, that directors and specialists in divisions are being trained right now. Right now, we're working with state folks, State Department of Ed folks, on the training and resources available for teachers and for those who will lead forward. The bill is not necessary because it's taking place. Thank you.
Good morning, I'm Florence Stewart with Virginia State Reading Association and the Virginia Association of School Psychologists. We certainly support this bill. Youngsters desperately need help in our schools with this issue. However, not all schools are going to have reading specialists because they are not required in the code. It's up to the local school board to employ them. Many schools have school psychologists available, and I have spoken with Senator Black about inserting one reading specialist or school psychologist employed by each local school board. The school psychologists are very well trained in this area. They are in fact the people who diagnose these youngsters. So we do have that availability of additional service in the schools and available to us.
Thank you. Senator Black, quickly.
Yes, I think a good point was made. There are some of the districts that do not have a reading specialist, and I think perhaps we need an amendment. I would suggest on line 69 that we insert the words having a reading specialist. So in other words, it would read one reading specialist employed by each local school board, having a reading specialist shall have trained and so forth. So in other words, to make it only apply to those that already have a reading specialist in place. So thank you for the.
Mr. Chairman, I don't see how this could not have a financial impact on local school boards or districts. When you can hire somebody or train somebody who doesn't have a financial impact, then again, it has the unfunded time impact. How many things have we added just today? We ask our local school boards to have somebody trained in and then to look for it. And I understand the problems, and it's a serious problem, and I understand what y'all have done, and I appreciate that and applaud you. But at the state level, we cannot keep dictating to local school boards and adding requirement after requirement after requirement after issue after issue after issue that they have to be trained for, to look out for one without providing any funding. And I'm not saying funding is provided.
Mr. Chairman, Senator Black asked me if I would respond. I just want to clarify, this is not a mandate. Virginia Department of Education is providing the training appropriate to the level of serving as a dyslexia advisor. So there's no fiscal impact for the training. And what Senator Black was saying is that it's not a mandate. If they already employ a reading specialist, then they could be designated to receive the free training from the Virginia Department of Education.
So, Senator T, I think that's a good point. There is a way to make sure we're that way and take the shall to obey that would allow the school districts to do that if we like.
Why do we need to add it? We're just May and they're already doing it, and we get May and May and May.
Where does the Department of Education too?
I'm telling you how you can make it voluntary. I'm not giving you options.
Mr. Chairman, right now they're not doing it. That is the problem with substituting May. And I do understand Senator Peach's concern. I don't think anyone here would accuse me of being a bleeding heart who is constantly, I've got one. But I'm not one who's constantly pounding to expand and expand. But dyslexia is such a widespread issue, and it is so treatable. We can actually do something. So many of the things, we can't really do anything. This is something we can actually do something, and it doesn't have a fiscal impact. So I really hope that we'll pass this.
Okay, welcome. Your opposition has some concerns, right?
Yeah, just concerns about physical impact. Even though the department is providing some training, there is a cost of time for teachers, and so there will be a physical impact in May, or I know that there is a House version coming over that says if employed by, that might help with a little bit of it, but there is a physical impact.
Mr. Chairman. Thank you. I just want to say I think this is a great bill, and I don't know if there are any dyslexic children here. I guess there aren't, but I want to give an example of a success story. It's my husband who could not read until he flunked the 3rd grade, and the second time through, they were able to get him an evaluation way back, 60, 70 years ago. And he ended up not only reading, but he has a PhD.
I'm gonna wonder if we can put the name on it. I think we need to do it. I just don't know that, we killed a bunch of girls in there today because they had exactly what's going to be said. And Senator Black, I think if we put a name on it, we could probably work out something and get it down the road and help. Would you be okay with that, sir?
Mr. Chairman,
Not so much.
honestly, I would rather simply have a vote
Okay.
without that.
All right, very good. So is there a motion on the bill?
Mr. Chair? Yes. Let me just ask one quick question. Did we adopt the amendment that Senator Black had suggested?
I don't believe that we
So
did.
there, we adopted the substitute, we did not adopt the line amendment.
And I'll second that.
Yeah, would you report the line amendment so everyone is sure about the line?
And this is different than the one that I gave the clerk, so
Right.
perhaps I should. Oh, okay.
Senator Black, please correct me if I record this incorrectly. One reading specialist employed by each local school board that has a reading specialist shall have training.
That's correct. Everyone understand the amendment? All those in favor of the amendment say aye. Those no, the amendment's agreed to. Is there a motion on the bill as amended?
Second.
Motion and a second that the bill as amended be reported clerk will call roll.
Senator Sasslaw. Senator Lucas. Senator Powell. Senator Locke. Senator Locke. Senator Barker.
Aye.
Senator Black.
Aye.
Senator Carrico.
Aye.
Senator Peterson.
Aye.
Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Chase.
No by proxy.
Senator Suderline.
No.
Senator Peake.
No.
Senator Newman.
No.
I have 7 yeas, 6 nays.
Okay, so the bill is reported as amended. Very good. With that, congratulations, Senator Black, and you have one more bill that defeats.
Thank you very much, Mr. Chairman. The next one is Senate Bill 1517. This is a bill that came to us from the Loudoun County School Board. And basically what the bill does is it simply permits a school board to, if they're providing transportation to pupils who do not live in the school division, that they can charge those pupils a reasonable fee to provide that transportation. However, they will waive such fee for any pupil whose parent is financially unable to pay it, and including free lunch students. And I believe I have someone to speak to this.
Yes,
Mr. Chairman, members of the committee, this bill brought to you by Loudoun County Public Schools. It's on the legislative agenda. The specific situation we have here is that quite a few students in Loudoun County attend high school at Thomas Jefferson High School. Busing those students to and from Thomas Jefferson High School costs Loudoun County Public Schools $400,000 per year. This bill has been discussed with parents. It's been the subject of at least 2 meetings or 3 meetings at Loudoun County Public Schools. Through lengthy vote, we try to get some of those funds back. I don't believe it impacts any other relationship we have with Fairfax County Schools insofar as our students attending TJ goes. It's just regarding the busing of children from school.
I understand. Are there those that are speakers, others who care to speak in favor of the bill? Are there those that like to speak in opposition to the bill? Any questions to the taken?
Why don't they?
I think Senator Todd and I asked that question first. Mr. Chair, are you you're voluntarily providing the busing, correct?
Yes.
And so you can decide voluntarily.
Mr. Chair, legally, is there any kind of regulation required? I don't think there's a regulation that requires us to provide.
No, transportation is somebody goes outside your school district and they have to pay for it, Mr. Chair. And then my second question would be, is it the deal, why can you not, if you voluntarily deciding to provide the transportation, provide them the bill for providing transportation without state law?
We don't have the authority to provide them with the bill without this action.
So you don't have access to do that?
We don't have the authority to send them the bill, Mr. Chairman.
Do you have, I think Senator Pete's question is, do you have the ability to do a memorandum of understanding to protect their children and get a financial payback for that?
I don't believe that exists in the statute.
Mr. Pete, further question?
Again, this has nothing to do with taking kids to a football game out of their county. It only has to do with taking kids from one locality to another locality for the purpose of them going to school there. There are quite a bit of deficiencies using the bus service instead of having the parents drive them all the way to Fairfax County when they might live and work in Nottingham. That's what we're going to do.
I think there's a problem here. It says when a school board provides transportation to pupils who do not live in the school division. But if Loudoun County kids live in Loudoun County, they live in the school division. They're going to school outside the school division. But I don't think this ain't ready for prime time as it is right now.
I'm sorry.
Not you're ready for prime time. I mean, Bill's not ready for prime time.
Oh, thank you very much. I think one of the situations we have students from Thomas Jefferson Academy who live in our school district, and we provide transportation to them, and just.
Yeah, I think we need to let go right for, because I think there is at the very least a wording problem. When you look at the bill, I think if you work with Senator Peterson, kind of get there, and we can get up now sort of on policy, but I think you want to make sure that you're accomplishing what you want to accomplish.
Mr. Chair, I would actually just bring one other issue they might want to look at here. I mean, it's one thing to have a student who lives in Loudoun County and goes to Thomas Jefferson High School, which is in Fairfax County. It's another thing to open the door here to saying that if a school division has an arrangement with, say, a school, another school to deal with students with autism or other types of issues, that we're going to open the door to charging, allowing them to charge for that transportation.
I think that's a good point as well. Let's, guys, you guys, I think the school boards, you guys need to work this out and probably work it out fairly soon. Or do it next week. Okay, what's that?
I think we do need to simply take it by for the time being.
And we'll take it out in a few minutes. Senator Vogel, I apologize, we certainly wanted to hear you a lot earlier, but you have Senate Bill 1546.
I just got to number 10 on the list, and I thought this first 9 must have been really brutal. I have Senate Bill 1546, and hopefully you, the committee, will see this as something very simple. As all of you know, pursuant to Virginia's Drug Control Act, the Board of Pharmacy in the Commonwealth of Virginia can act on an emergency basis and designate a drug as a Schedule I controlled substance. And that has just recently occurred in the case of synthetic opioids that have been wreaking havoc on those who suffer from addictions in the Commonwealth of Virginia and have caused a number of deaths. These synthetic opioids, one of the ones most commonly known as pink, is 8 times stronger than heroin. And so the Board of Pharmacy, in their wisdom, enacted an emergency, on an emergency basis, made them Schedule 1 and actually made them a controlled substance. That lasts for 18 months. They don't remain a controlled substance unless the legislature comes in and enacts legislation to make that permanent. So that's all that my bill does. It makes them permanently Schedule 1 drugs. My bill was initially drawn very narrowly just to cover one of them, but I have expanded it to be identical to Delegate Garrett's bill that's being introduced in the House to cover all of those that were recently enacted by the Board of Pharmacy. So that's what the bill seeks to do, and it's really an effort to, I think, do what we have to do in Virginia, and that is address this opioid abuse. And if it's 8 times stronger than heroin, it should not be on the street, and shouldn't be legal.
Okay, I don't think there's any problem with the bill. Is anyone here speaking or in favor of the bill, or opposition to the bill? None? Motion and a second that the bill be reported. All those in favor say aye. Those no, the bill is reported.
Thank you.
Okay, so the bills that are left, are they just my bills, the center block bills, so, so there are, I have 2 bills, if the chairman would consider those. Senate Bill 1556, we've taken care of. That's Senate Bill 1414.
Senate Bill 1414, dealing with school-specific home instruction.
Mr. Chairman, there is someone that's here to speak to the bill, but basically the bill is one that we put in the code a while back that school divisions would notify these home students, students on the availability of certain written tests that would be available to them. This goes through and kind of outlines the process that will be done and indicates that there will continue to be notice on the bill. If you would hear those that are in favor.
All right, those that are in favor of the bill, if you'll come forward.
Good morning, I'm Yvonne Munn with Home Educators Association of Virginia. We support this bill because it clears up out-of-date language that's in the code. Homeschoolers have been able to take the PSAT test since 2005. All students, including homeschoolers, are required to register at their local high school in order to take the test. And each high school determines when they're going to order the test, Mr. Chairman. Ordering varies. We may have a homeschooler that calls to register and they are told that they call in August and of course it was ordered in July, or they call in another month and it may have been ordered a week before. So there's no indication when homeschoolers are supposed to register for the PSAT test. So we're simply asking in this legislation that the test name be updated. This is the year that the new test is going to be implemented in 2017, and this would establish a deadline and notify homeschoolers of the deadline so we can register for it appropriately.
Thank you. Is anyone else in the audience want to speak? Senator Howe.
Thank you. I'm just curious how the schools know about how to contact the homeschoolers.
I think this question is
Superintendents typically will respond to a notice of intent for those parents who registered homeschool. They send a letter after they receive the parent's notice of intent, informing them that they have received the letter, telling them that testing is due August 1st, and they can easily include the date for registration for the PSAT in the same notification letter that they send.
Any other questions? All right. Real quickly.
Scott Frank-Guar with Consulting, representing ACT. Want to ask the question as to whether or not there was an amendment to this bill relative to the pre-ACT?
We are going to take up the matter, so.
Thank you. You support the bill.
All right. Anyone have any opposition to the bill?
Mr. Chairman, I don't hear any of the education community sign, and so if there's no opposition, there is an amendment.
motion on the amendment? Okay, all in favor say aye. All opposed? All right, it's accepted. We have the bill before us, there a motion?
Move to report as amended.
Been a motion to report as amended and second. All in favor say aye.
Aye.
All opposed? All right, one no. No, two no. Just one. Two no's.
Mr. Chairman, next up is Senate Bill 1099. Mr. Chairman, I think there's a piece of metal in this bill. This bill just has us defining some of the terms. And Mr. Chairman, as you look at the bill, we're trying to make sure that if you end up having an SOL test, for instance, that those would be called the SOL, and it would be transparency on what the nomenclature is. I don't think anybody's in opposition. I think you support the bill, but I don't think anyone's here.
So Tom, there wasn't support on your side.
Okay.
Okay. Anyone in the audience like to speak in opposition? Everybody who likes to give me a thumbs up and, okay, we're good. We have to go forward, Senate Bill 1099, is there a motion? It's been moved, second, to report Senate Bill 1099, all in favor say aye. Aye. All opposed? Bill is reported. Second.
Mr. Chairman, if you are okay, I think what we're going to do is pick up now Senator Black's bill. Senator Black. So we'll go back to the bill that we had before, and I believe there is now an amendment that is generally supported. So I'm going to.
Thank you, Mr. Chairman. Senator Black, on line 22, after pupils who strike do not live in the school division, insert attend school outside the school division. And then on line 25, after the pupil at the beginning of the line, insert who receives special education services pursuant to federal IDEA, or, and then it'll read whose parent is financially unable.
Mr. Chairman, I believe Senator Peterson, let's work on that also.
So, Senator Peterson.
Sure, I think we're good.
Motion is second that the amendment be agreed to. All those in favor say aye.
Aye.
Those no, the amendment is agreed to. All right, so why don't we just wrap up on what the bill does now, and then we're going to kick them. So, Senator Black.
Again, Mr. Chairman, the board, the bill basically is providing transportation to pupils who are outside of the division, but they are transported using division facilities, and so they can be charged for that so long as they are not low-income individuals. That's the essence.
Okay, everyone understand the bill? Senator Sudeline.
So is this for Loudoun County students that go to Thomas Jefferson and Fairfax?
Yes.
And so currently they're not charging, now we're going to start charging them?
That is correct.
What's up the left, yeah.
So, very good. Is there a motion on the bill as amended? Motion is second that the bill be reported as amended. All those in favor say aye.
Aye.
Opposed, no. Okay, the bill is reported as amended.
Chase.
So Chase, Sudeline, Donovan.
Chase.
There's one more bill. So I'm going to turn the chair back over to Senator Carrico. I think the last bill on the docket is my bill, which is Senate Bill 1098.
Senate Bill 1098.
Mr. Chairman, Senate Bill 1098 is also a transparency bill. It just ensures that when the board is considering the standards of accreditation, that it will do it in a transparent process, and that there will be an objective measurement. So what we found is occasionally have school divisions that either don't make the first cut, and before you know it, they have made it, or they don't make it, and then they stay don't make it. It doesn't appear to be a clear understanding of why maybe the Lynchburg school made it and Vedder County School did not. This would give transparency to the process and also make sure that there is a objective standard. I don't think anybody, to my knowledge, is in opposition to it.
All right, does anyone on the committee have a question to make? Hearing none, anyone in the audience like speaking? It's not enough. All right, anyone in opposition real quick? Okay, seeing none, there's been a motion and a second to report the bill. All in favor of reporting Senate Bill 1098, say aye. Aye. All opposed? So reported.
Thank you. So, and does that complete our document? Okay. So that completes the docket, and so with that information, the committee will thank you. No Friday meeting, right?
Thank you, Mr. Chairman.